Thanks for joining us for News 3 Now at 6. We hear about COVID-19 deaths and hospitalizations every day, but there are also thousands of people who survived the virus and still haven't fully recovered. Naomi Coles met a Janesville teenager who just wants her life back.
She's traveled the country for top cheerleading competitions.
Those are all my medals from All-Star Cheer.
Now, Ava Pennycook of Janesville would be happy to get through a practice.
I don't know where I stand because they didn't put me in any stunting groups.
Just 15, Ava's still battling a virus that her friends don't understand and some leaders downplay for the young. She tested positive for COVID-19 on July 23rd.
But I was healthy before I got it. So.
After weeks of nausea, no appetite, stomach pain, and difficulty breathing that at one point landed her in the ER, she tested negative in August. But 82 days since her positive test, life hasn't returned to normal.
Body aches and the hot flashes and the headaches, yeah.
Ava still can't smell. Formerly an honor student, she now gets easily confused.
I fumble over my words. It was funny at first, but now it's kind of concerning.
Extreme fatigue, dizziness, brain fog, all those and more are symptoms of a phenomenon thousands around the world experience, the COVID long hauler.
You know, it is very new. We're still learning. It is important to come to grips with the scope of the problem.
Once they test negative, which in Ava's case took 4 weeks, they aren't still contagious, says Dr. Nasia Safdar with UW Health. Because long haulers may not be getting active medical care, she says it's hard to really pinpoint how many may experience this. A CDC report in July found that 1 in 5 millennial-age healthy adults didn't return to normal weeks after testing positive. And according to reporting from The Atlantic, the average age of long haulers is 44.
But what we're learning, I think, is that you can't just assume that just because somebody has mild symptoms to begin with, that they will bounce back immediately.
Without much available information in the medical world, Ava's mom turned to a COVID-19 survivors group on Facebook. Suddenly, like thousands of others, they felt understood.
Within 2 minutes, everyone was like, yeah, we all get hot flashes.
Because for Ava and her family, they're having a hard time getting through what sometimes feels like an isolated perspective.
It can happen to anyone.
Yeah. Ava's mom didn't want to go on camera, but she told me today that the journey can be discouraging. A lot of public messaging emphasizes children's low risk, even while doctors warn about how much we still don't know. And for Ava and many others, measuring risk has to take a whole different form.